Hello, my name is Allison McGrath. The date is 9/4/2021. Today I am going to be pointing out some structures of surface anatomy on my boyfriend here, Connor. So the first thing I'm going to be pointing out is the cubital fossa. It's this little triangular indentation on the interior of the arm. It's on both arms. Another point to point out is the laryngeal prominence, otherwise known as the Adam's apple. You also have the jugular notch, which is right in here. And then the mental protuberance is right here. And if you look forward, the zygomatic arch is right in here. So each of these different locations of surface anatomy can be linked to different body systems. So going back to the cubital fossa, that would be most closely linked to the circulatory system, just because it is formed by the three main veins that are best to draw blood from. Also, the jugular notch, which is right in here, that would also be considered a part of the circulatory system because it is formed by the jugular veins. And then the mental protuberance, it's also known as the chin, that would be considered a part of the skeletal system, along with the zygomatic bone, that's a facial bone that can be considered part of the skeletal system. And then lastly, the laryngeal prominence, that would be considered part of the respiratory system because the larynx, that's where the air travels down through. So surface anatomy is very important, especially if you're in an emergency care setting. You're going to want to know certain landmarks to look at when you're performing certain procedures. So going back to the cubital fossa, if you know where this is and you know where the different veins lie along it, you'll know where to best draw blood. Another example would be doing a tracheostomy. If somebody's having a difficult time breathing on their own, you would perform this. So knowing where the laryngeal prominence is, you would perform the tracheostomy just below it. So that would be really important to know if you're, pinched for time, if your patient isn't breathing on their own. Another example would be a spinal tap. So I'm not going to lift up his shirt, but if you know where L3 and L4 are, which they're kind of out of view, they're down here in the lumbar spine. That is where you would insert your needle for the spinal tap. Surface anatomy is important mainly for performing various procedures. It makes it a lot easier to know where you're going for them. So that is it. Thank you.